is the largest private independent hospital in the UK. It's part of the international care group HCA, giving it the resources to keep investing in the latest technology and facilities. Arranged in its own campus on the edge of Regent's Park, the Wellington is a major multidisciplinary hospital where specialist medical teams, led by outstanding consultants in their field, treat the most complex as well as commonplace conditions.
Well, the Wellington Hospital is the largest independent hospital in the UK, and we pride ourselves on complex tertiary care, right at the high end of medicine. We use the best consultants and professors with the very latest high-tech equipment.
For patients with complex, life-threatening conditions, access to the very best intensive care is vital. The Wellington has over 50 high-dependency beds. 24 of these are equipped for the highest level of intensive care. There's also the brand new multidisciplinary Platinum Medical Centre, a £25 million investment in diagnostic and outpatient services. The Wellington's diagnostic and imaging department is the largest and most advanced in the UK private sector, with 2 CT scanners, a PET CT scanner, 3 MRI scanners, and nuclear medicine, ultrasound and interventional radiology. All these systems are linked to a digital archiving system networked to consultants throughout the hospital.
This is a record system for X-rays and scans, and it means now that we're able, instead of having to have hard copies of scans carried from institution to institution, to look at all the scans on a desktop computer in the consulting room. They're available immediately after the imaging's been completed in radiology.
With its sophisticated lung function laboratory, the new respiratory unit is another major investment in advanced diagnostics to support cardiology and other services.
It might be a patient that's been wheezing as they do exercise, or it could be somebody that's had a chronic cough over a long time. So anybody with a respiratory symptom that sees the consultant generally has to have their lung function measured at some point.
The Wellington has over 400 of the UK's leading consultants across 40 specialist departments. Most of them hold senior consultant positions at London's famous teaching hospitals.
The X-ray tube's going to swing round from your right to your left and back again, because the heart's got 3 dimensions, so we have to take pictures.
The Cardiac Services Unit provides the full range of invasive and non-invasive tests and procedures, such as coronary artery bypass and valve replacement and repair, and has a capacity for up to 45 inpatients. Here, the revolutionary Da Vinci robot enables complex operations to be performed through tiny incisions in the patient's chest.
The robot is an in-between myself and the patient in order to produce what my hands wouldn't be able to do unless they were inside the patient's chest. So this is just a unique piece of equipment.
Okay, so what we'll do is put another needle in, and then we'll get another X-ray.
Neurosurgical procedures, including brain and spinal surgery and removing brain tumours, also use the latest minimally invasive techniques.
For spinal surgery, we're using a system called Metrix, which is a system of probes that will progressively open up a track to get us to the spine, often being able to remove a disc through an 18mm incision. So the patient is up and around the next day and home within 2 or 3 days of surgery.
Okay, some nice long sticks, making sure those heels come down first. Well done. And we might just speed it up a little bit.
For patients recovering from neurological conditions, head injuries or strokes, the Wellington Hospital has a 45-bedded acute neurological rehabilitation unit.
One of the special things about this unit is that it is able to take patients in the acute phase, because we've got this fantastic synergy between neurorehabilitation, neurology, neurosurgery, and lots of medical specialities as well. So we can really look after patients very, very carefully from a medical perspective. And that's essential to be able to deliver rehabilitation from the outset.
Down below, have a little look inside the stomach with a little tiny gastroscope. It's thinner than my little finger.
Gastrointestinal consultants treat conditions like bowel disorders and bowel and stomach cancers using minimally invasive techniques wherever possible.
And the great advantage of endoscopic techniques is that they are non-invasive. So with a bit of throat spray or a bit of sedation, we can carry out these procedures completely safely without the need for a general anesthetic. And we can do a lot more non-invasively than we used to before.
In orthopedics, the Wellington's leading surgeons treat every part of the musculoskeletal system, with specialist spinal, hip, knee, foot and ankle, and hand and wrist clinics.
And for those of our patients who are unfortunate enough to present after a spinal injury with spinal cord problems or paralysis, we're able to have a close liaison with the rehabilitation team to optimize the outcome.
Hello, how are you? My name is Sohana, I'm helping the anaesthetist.
The gynecology unit at the Wellington has its own operating theatre, treatment suite and 10-bedroom ward. It's the largest private unit of its kind in London, treating the full range of gynecological disorders and cancers.
Most of the surgery now for endometrial cancer, cancer of the lining of the womb, for cervical cancer, cancer of the neck of the womb, is done really by minimal access. We're now 48 hours and people at home, and they're so much quicker at getting back to normal function with their sort of families and with work.
My name is Emma, I'm one of the radiographers here. Doing a scan of your chest today.
This investment in minimally invasive technology means that many more treatments can now be performed on an outpatient basis, either at the Diagnostics and Outpatient Centre at Golders Green in North London, or at the new Platinum Medical Centre on the Wellington campus.
It includes 50 consulting rooms, a very large diagnostic unit, which has CT and MR and the very latest low-dose PET-CT as part of our cancer programme. It also has 4 operating theatres and a whole a range of equipment, the very latest in technology actually.
This is just going to squeeze your arm a little bit, and this will just raise the various there. So if you just relax your arm down.
The new Platinum Centre is also the centre for the Wellington's cancer services, now provided in partnership with leaders in oncology care. It means that the Wellington can now manage a patient all the way through their cancer journey. The new oncology suite features high-end cancer-specific imaging, a 10-bay chemotherapy suite, and a dedicated oncology pharmacy.
I think that the idea behind the integrated service is quite exciting. All patients will be discussed in a multidisciplinary team, so all the specialists will come together when a patient is first diagnosed with cancer to discuss that case and decide from the outset how best to treat it.
The Wellington insists on the highest standards of cleanliness and patient care.
It's bright, it's clean, it's well lit, the equipment is great, the staff are of a very high calibre, and you come here with your patients and you can practice medicine as it should be practiced.
The Wellington is the natural choice for almost any complex medical procedure. Besides outstanding medical attention, every patient who comes here and every relative or friend who visits them gets the understanding and support they need at this important time in their lives.